Okay, I'm set. All right. Okay. Good afternoon, everyone. I thank you for being online, either here present or from far away. I was asked by Deb Woodhouse to come out today. Let me introduce myself for those that don't know me. My name is Sue Chamberlain. I'm a certified infection preventionist. I've worked with CMY fertility over the last, Deb, has it been about 10 years now? It's been a long time. Yeah, doing in-services. Now, I retired 2 years ago, but guess what? I really retired. I started consulting within 3 months after retirement, and over the last several months, I've been working extremely hard, as you can imagine, over this coronavirus. That's why I'm here today. I'm going to give a very brief presentation. I'm going to ask for questions if you have any. And if you don't have any but do have something afterwards, you can either give me a call or you can forward the question to Deb, and Deb can forward it to me. So let me tell you about my life over the last several weeks. Coronavirus, about 5.5 or 6 weeks ago, really caught my eye as it started to spread from China to other countries. And I knew, because of past experience, soon it would get us. So myself and my infectious disease doctor that I consult for said, let's start planning. In the event that the Corona COVID-19 should come our way. So I've been doing the preparing. So my message is going to start off today is, and I'm serious about this, don't panic, but be prepared. Now, some of you people are old, but not as old as I am, and I see a couple of girls here that probably weren't even born back in the days of SARS. But here we go. We'll start and see what happens. Am I doing this right? There. What is exactly COVID-19? That actually looks like the COVID virus if you look at it underneath a microscope. We have Deb here, and we have other people that have worked in the lab, and they certainly can identify. I had to look it up to find out what it looked like myself. But it's a new novel virus. But it is similar to about 7 other viruses that we've seen over the last 20, 30 years. Actually, more than that, because the first coronavirus appeared in the 1960s. And I've been in infection control for 28, 29 years. And I know SARS, which happened in 2002 to 2003. Then we had MERS, which was another coronavirus. Then we had H1N1, and now we have this COVID-19. We call it a novel virus, even though it belongs in the family of coronaviruses. We call it a novel, being that it's taken on a different characteristic. Some of the novel viruses cause more illness, more mortality, more morbidity than others. Why is everybody concerned about this? Well, we're concerned about it because it's novel. We don't know really what it's going to do until it fades away. And once it fades away, we may not see another novel virus. Well, we may see this reemerge in 6 months, but after that, we may not see another novel virus for another 5 to 8 years. But it is affecting us now worldwide. Another thing I'm going to tell you right now, and it's very, very important. Do not take everything you hear on the news as the truth. Got it? It is so important. It's important that you look for your information on the CDC website, and I'll give you some other websites to look at the end of this presentation. But the symptoms of this corona, COVID-19, are similar to the flu. You get fever, cough, and shortness of breath. We also look, had you had recent travel to one of these countries like South Korea, Italy, China? If you travel to them where it's very endemic meaning in that particular area it's widespread. Well, now we're not looking at travel anymore because we know that it's somehow, it came to the United States like we all knew that it would do. And now we're seeing people that are coming down with the COVID virus that have never traveled to any of those areas. So we know that it's being spread from person to person. So the bottom line is, when do you have to worry? And I'm going to say, when do you have to worry? Think about this. I would not observe this on my daily routine other than to taking basic principles of good hygiene. But besides knowing what the symptoms are, which are similar to the flu, and remember, the flu season is still in progress. And we're still testing lots of people for the flu. So this is kind of similar. So if you're tested, you go to a doctor, and a doctor is allowing you to come in because with your symptoms of fever, cough, and shortness of breath, and I'll explain that in a minute, you're going to first be tested for the flu. And if that comes back positive, okay, give you a little Tamiflu, send you home, you're going to be there at home for a while, and that's it. We also are concerned if you've had any contact with anyone that you know that has been diagnosed as having the COVID-19. Now, in the central New York area, up near Rochester, there's one case. Why is there only one case in central New York? The answer is just very simple. We haven't been able to test. We haven't had the test kits to test. So once we start testing, guess what? We're going to find more people that have it. That's a reality. There's so many realities to this, we have to say, okay, this is what it is. If you come in contact with a person who's under investigation for COVID-19, and they call that a PUI. Are you a PUI? Well, anyway, what that is say I had COVID-19. Positive. And Deb, I didn't know it at the time, and I say that day, Deb was in contact with me, and guess what? Or maybe I was sick for 3 or 4 days, and I got in contact with Deb. Well, Deb now has become in contact with a person who's had the symptoms and is under investigation. And then I find out I have had it, so now she's the person under investigation. It's just a rolling wheel all the way around. It's transmitted by coughing, sneezing, and also it's spread by contact, the objects you touch. So it's very important you remember that. We'll talk about that in a minute. So travel is no longer a priority, with the exception here at CNY Fertility, and in your other locations, you're seeing people from across the nation. You're seeing people from foreign countries, although recently, as of last night, no travel from certain countries into the United States for the next 60 days. So, but Dr. Brody, as I say, the infectious disease doctor that I work with, both of us agree that travel is not an issue anymore, because we're seeing so many people that are coming down with COVID-19 that haven't had any travel or haven't been exposed to anybody they know that has traveled. Very important. And somebody forget it. I get so many calls, I try and keep them straight. Somebody called me and said, I'm so worried. She was a secretary in a doctor's office. She has no contact with any patients. and she does have an anxiety disorder. And the poor thing was just so anxious. And after an hour talking with her, I don't even know if I calmed her down. I suggested she see her physician because she does have anxiety issues. But I see the rampant of those that don't believe that this is a problem at all, to those that believe that it's Armageddon and that they're going to die today. So we have to look at the people in between, and hopefully we can reach out to them and they can help their fellow people. So we know that it's community transmission. And so I'm going to put the slides away. So I'm going to just give you some free information. It's kind of free from the mouth. Number one, for you people, what are you going to do while you're at work to prevent the spread of COVID-19? Because any one of you people here could have been potentially exposed. Go to Wegmans. Go to Walmart. Go to Target. Haven't I said this before with the flu? You can catch the flu at Wegmans, Target, Walmart, the theater, any place. You can catch it. So it's out there. We know it. We don't go ape over the flu. Some of us do, but majority of us, 90% of us do not go ape over the flu. Yes, the flu has a vaccine that will help prevent or minimize the effects if we do come down with the disease. But nonetheless, what I want you to do, be prepared. I want you to triage all your patients. And what do I mean by that? I suggested to Deb the following. You have a portal in which information regarding your patient is in. I've suggested what other offices are doing. That is clinics, doctor's offices, surgery centers, they're all doing the same thing. They're doing the following. If a patient has a scheduled appointment, say they have a scheduled appointment for March 14th. It's all been scheduled. You send out on the portal a reminder, you have an appointment with us on March 14th. Please do not forget that. And then you put in that, if you are experiencing any cold symptoms, cough, fever, shortness of breath, please call our office immediately, as we may reschedule you. Because you're going to try to minimize people coming into the office who are sick. Now, that person says to herself, she read it, she got the reminder, she doesn't need to call because she's not been exposed to anybody that she knows. She doesn't have any cold. She doesn't have any sore throat. She doesn't have any flu-like symptoms. So she's all set to go. But guess what? Now she comes in the office that morning and, oh, by the way, I don't really feel that good. Yesterday I woke up and I've had this terrible cough. Oh, low-grade fever. What are you going to do with that patient? She's there. She may have traveled from East Egypt or someplace else or down the street. What are you going to do? You're going to give her a regular surgical mask and ask her to wear the regular surgical mask. You're going to alert one of the nurses or the providers and bring her into a room and shut the door. Simple. Then you're going to alert the nurse what you did, and the nurse is going to go in and she's going to wear a mask as well. Always remember, I say this, chances of you getting a patient that is elderly, and if you put a mask, I don't mean on an elderly, but if you put a mask on someone that's really short of breath, that person may really become ill because the mask prohibits them from breathing. So you put the mask on them, see that they're doing okay, and bring them right to a room and notify a nurse. That way you're minimizing the exposure. They're not sitting out in the waiting room exposing everybody. They're not coughing in your face. They're going into an exam room. It is really, really. So have a message on your phone. Have a message at the entrance of your facility that if you have cold and cold symptoms, please let the secretary upon entry know that you're going to give them a mask. Another thing I'm going to suggest for all offices, do not leave your mask out. Keep your mask behind the desk because people have pilfered boxes at a time. They've walked out with hand sanitizers. People are crazy and they're desperate. They go out to stores and buy 60 rolls of toilet paper because somebody told them, don't panic, but be prepared. Well, this is true craziness. Really, we'll talk a little bit more about that. While you're at work, I want you to remember the following. I want you to stay home if you've got a fever. Most importantly, I don't care if the fever is from an abscess on your leg, flu-like illnesses, but stay home. You should not be at work. Now, we all know when you have a cold, that cough may last forever. If you're a smoker, it may last for 6 weeks. You're not going to take 6 weeks off of work, girls and boys. Ain't going to happen. Use common sense. But if you do come to work, you're not short of breath, you don't have a fever, but you've got that lingering cough, you may get strange looks and nods from the person next to you. Put on a mask. If the cough is really bad, sometimes you have a spell where the cough is bad, get up, walk away from them. But we do understand that. I want you to make sure you wash your hands frequently. Purell hand sanitizers, you can't buy them anymore. Well, there was a time in my life, because I'm so old, that we didn't have Purell. We had soap and water. You're not going to get Purell. If you do, would you please send me a bottle and call me? Because I want a bottle, because I have none. But the important thing here is that to wash your hands and wash your hands frequently. Well, at work, make sure your work surfaces are clean. It doesn't matter if this is flu season, COVID, MRSA, those resistant organisms. Your workstation should always be free. And they did a study just as an add-in. What do you think is the dirtiest thing we have on our person? Thank you. She knows. Is your telephone. It's the filthiest thing. Clean your phone off frequently. Very important. Cover your cough. Now, does anybody know what the T-zone is? T is in the alphabet. The T-zone is your eyes, your nose, and your mouth. Keep your hands away from there. Your hands may be contaminated, whether it's the flu, whether it's MRSA, whether it's COVID-19. Your hands, you touch your eyes, your nose, and your mouth, you transmit infections. And they're finding that because this is a contact and a respiratory spreading disease, it's important to keep that T-zone free. And it's interesting, have you ever noticed, watch yourself when you go back to work, how many times you touch your face. Now, I tried to be good and not demonstrate it here, but I'm sure one of you have already said, she's already touched her face. What the heck is she talking about? Because it's very hard. Please remember that. All right. And then, if you are sick, call your primary care physician, as you would do with anything else. Now, about the COVID-19, like I said earlier, we were unable to test for the COVID-19 because we didn't have the test. We've only tested approximately 10,000 people out of a population of 350 million. Where Korea tests 10,000 a day. China was testing hundreds of thousands a day. Don't ask me why. Because on something like that, I will go ballistic because this is what I'm not afraid. Maybe because I'm too old to be afraid, or maybe because I've been through SARS. I know what we can do to protect ourselves. I've been through MERS. I've been through H1N1. I've been through bird flu. I've been through them all. I know what I can do. And as I've aged, unfortunately, I'm in that risk of being potentially high risk of getting, if I were to get COVID, having more complications. But yet, I'm not fearful. I'm not stupid. I know what I have to do. It is what it is. Let's get on with life. Okay, another thing. Work with your, Deb, anybody in the other sites, work with your medical supply companies to make sure you have your stash of PPE that you need. Because in this, if you were to take care of somebody that's suspected of having COVID, you must wear the following. You must wear a mask, preferably an N95, which you have to be fit tested for, which people aren't fit tested for. So you're going to go enhanced and wear N95, but you have to go through different things, and I would talk to Deb about that. You have to wear goggles. You have to wear a gown, and you have to wear a glove. You have to be retrained on how to put on and take off your personal protective equipment so you don't contaminate yourself. This all went through when we had Ebola and Zika and everything else. Very important. But it's important that you work with your medical supplies. I can tell you, I was telling Deb, my days over the last 2 weeks have started, no exaggeration, at 5:30 in the morning when I get my calls. They start. And I'm saying, who the heck is up at 5:30 in the morning? And I'm going to share something else to prove about what I'm saying to you. It's coming not just from my heart, but from my head. I was on a conference call last night. Pre-conference call at 7, conference call at 8, and post-conference call at 9. The audience were about 150 physicians from Central New York. Myself and Dr. Brody were holding this conference call. When I was done, my husband came into I left my office and went to my husband's office. You know, we both have our own office. I don't know. Anyway, he was on the phone. He was talking to his sister, and I heard him say the following. Well, you know, she retired, but this is not retirement. And I heard him say, I'm really worried about this virus. I'm really scared. This is my husband. Now, I have to tell you, my husband doesn't know how to take a temperature. He doesn't know what a thermometer is in order to take a temperature. So he's telling his sister, I'm really worried about this virus. I haven't been able to talk to her about it, but all I know is she's frazzled. And so I interrupted and I said, put her on speaker. I said, I'm not frazzled and I'm not worried. I'm tired and I've had 15 meetings in the last 4 days. Why? Is it because we're worried? No. Infection preventionists, the medical profession, locally and in Central New York, are doing everything we can do to give you the information we have. And so it's going to take lots of hours. It's going to take lots of time. It's going to take lots of changes. But why do we do it? It's for the good of the patient, and it's good for the healthcare workers like you folks. So we may look a little frazzled. We may come up with some information today, because this is based on 12:02 this afternoon, but things tonight may change. It's such an ever-flowing, changing, because a lot is not known about this novel virus. As far as the female population that is pregnant, There's very little information at this moment, at this time, on the effects of pregnancy. Are they at higher risk? What about the fetus? What about moms nursing, etc.? The only thing I can tell you, they have not found any breast milk that was significant that had the virus in it. The rest of the information regarding the corona COVID virus is under investigation as we get cases and we can study the pregnant population. There was a webinar on at 12 noon as I'm talking that maybe one or two of you folks have been able to view more information about pregnancy and the COVID. But for you mothers that are nursing your babes and worrying that, is there any problem with the milk? So far, breast milk has not contained any of the viruses. That I thought was good. At home, probably the most important thing that we told everybody 5 weeks ago in family care is that plan for alternative daycare for your children. Or if you are responsible for making sure that a loved one, a mother, a father, a sister, a brother, whatever, has to have care, medical care or assistance while you work, and all of a sudden that care is not there, so it lies in your hands, make sure that you have alternate plans. I made sure that my son and his wife, they're a young couple, they have two little ones, a 4-year-old and an 18-month-old. I said, what are you going to do if, daycare shuts down and you both have to go to work? Well, my son is a teacher. If that were to happen, probably schools would. But my daughter-in-law is a lawyer. What are you going to do? And they said, well, we're going to bring them to you. I said, no, Dermis is not available. I would be. But you must make sure you have alternate plans. So very important. Make sure you maintain an adequate supply of food, medications, etc. And you don't need to buy 64 rolls of toilet paper. Again, my age is, I'm telling you my age without telling you. In 1966, I was brought up in Oswego, and we had the Oswego snowstorm. We were in the house in Oswego for 5 days. It was a family of 8 of us, 6 kids and 2 adults. Didn't have much food because my mother probably shopped every day at that time. But it's important that let's not go overboard. The most important thing is to make sure if you wait until you've got 1 pill because you're on medication, 1 pill left, call your pharmacy, get it filled, make sure you've got your supplies that you need. It is so important. I said to my husband, and he just thinks I'm flippant, but I said to him, I'm not going to go get 2 weeks of food. We have enough food in the cupboards that cans of this and that we can eat forever. And I said, and if I did, I'm going for the 3 C's. I'm going for chocolate. I'm going for chocolate chip cookies. And I'm going for coffee. That's what I'm going for. 2 weeks supply, I'll stay in my house. And I'll binge watch. Stay away from crowds. Social distancing. So important. Why would you want to go to a place where you're crowded in during flu season or during this season? Stay away. I don't even know why. I'm Irish, okay? But I don't know why they're holding the St. Patrick's Day parade tomorrow or Saturday. Huh? Are you kidding me? Oh my gosh. Well, I went nuts about that, I gotta tell you. Because it's not so much the parade, you're outside and you can distance yourself. But everybody then goes into bars. And they crowd into bars. And then that's what people do. Stop it. You don't need a social distance. Cover your cough. Remember your T-zone. Contact your primary care physician with any questions that you may have. And then make sure that you can also call me. Here's some information regarding the COVID-19. Coronavirus.gov. Excellent. CDC.gov. Excellent. New York State Department of Health, excellent. Your primary care physician, he may not get back to you, but if you're experiencing symptoms of COVID-19, testing is now being performed at doctors' offices, or if they're not today, they will be by Monday, because we have the labs that will do it. And again, my last thing is, this is not a time to panic. It's a time to prepare, just like you're going to prepare. You know, you all go out to the store when it's a snowstorm, right? You get eggs, milk, and bread. Is that it? Again, I'm going with 3 C's. In the meantime, just be prepared, and especially if you have young children, alternate child care, because that can ruin your life. Does anybody have any questions?
So will you just remind everybody proper hand washing, the length of time it takes?
Proper hand washing, soap and water, at least 20 seconds. And you should do it. Now, you're going to think I'm silly. You should do it after you go to the bathroom. I say that because I used to monitor hand hygiene in the hospital. And I would stand outside of bathrooms, and I would hear flush, and I would never hear the faucets turn on, and people would walk out. Okay, it happens all the time. It does. 20 seconds before you put your makeup on, before you smoke, after you smoke. It's important before you eat, after you eat. It's important that we do frequent hand hygiene. Make sure the surfaces of your area that you're clean or that you're working with is clean. And it's okay to remind somebody that, I'm a little worried about your cough. Could you cover your mouth and dispose of the tissue? I don't even give anybody the elbow anymore. When I greet somebody like this. It's like, and I'm not a germophobic. And the one last thing I don't do, Grandma Sue, when my grandchildren, because I seem to get everything the grandkids get. The snotty-nosed little toddlers, I get it. So during this time, I want to protect them in case I was exposed, or if they've been exposed and they're just carrying that little virus that isn't hurting them. They're going to give it to Grandma Sue. I don't think so. I have not kissed them, and we have this. We love you. We do this. We love you. That's what I'm going to do. Social distancing. Let's see. Where's Dr. Kiltz? Is he here? If Dr. Kiltz is in the buildings, I want to wish him a happy birthday. Now, does anybody have any questions? Okay, I'm off to another conference. Not conference call, another meeting. To be followed by a meeting at 5. I thank you very much for having me.
Thank you, Sue.
You're welcome.
Appreciate it.
Now, let's see. Oh, wait a minute. Watch, I'll walk out with this.